Just in time for back to school, the CDC has released new information about vaccine rates among American kindergartners. So the agency said vaccination rates decreased by 0.1% last year for all tracked vaccines, and vaccine exemptions among kindergartners increased to 4.2%. That's from 3.6% the year before. So this new data follows the order we told you about last week from President Trump. He's telling states to allow religious exemptions from school vaccine requirements. For more on what this means for parents, CBS News medical correspondent Dr. Celine Gounder is here. She's also the editor-at-large for public health at KFF Health News. Okay, so I feel like this is kind of an ongoing thing. You know, the goalpost keeps moving. So this data, I think for folks that just saw that on screen, it could feel startling, especially if you've got someone going to school. All states require certain vaccines for kids entering public school. Can you explain how the exemptions work?
Yeah, so big picture, you have the CDC that makes the recommendations. Then you have state legislatures and state health departments that actually make the requirements. Since 1905, the Supreme Court has honored or respected the right of states to do this. Now, you have medical exemptions and you have religious exemptions. So medical exemption, maybe you have an immunocompromising condition, so you cannot get a live virus vaccine like the measles vaccine. Those exemptions have stayed stable. What this JAMA pediatric study looked at is for states, there were 4 states that decided, you know what, we're going to get rid of the religious exemptions. So that's New York State, California, Connecticut, and Maine. And when they got rid of the religious exemptions, they saw vaccination rates go up. Meanwhile, in the rest of the country, you, as we saw, are seeing, in particular, religious exemptions go up. Vaccination rates go down. In some states like Idaho, you have 18% exemption rate at this point. So that's really very high when you consider you need 95% coverage for measles immunity, herd immunity. If you have 18% of the kids opting out, you just don't have it.
So this comes as this year marked a 35-year high in the number of measles cases. Speaking of herd immunity, I have a 3.5-year-old. She's about to go to 3K. If she's vaccinated but other kids are not in her class, what does that mean?
Well, it means you could have a measles outbreak. And this is a big deal for kids who are not vaccinated, because if you're not vaccinated in the middle of a measles outbreak, you're going to get sent home for 21 days because you've been exposed, and they want to make sure that there's not
even for a kid who's been vaccinated.
No, for unvaccinated.
Unvaccinated. Okay.
You know, so if you're a parent and you don't want your kid to be home for 21 days, you really want to get your kid vaccinated because they're not going to let that kid stay in the classroom if they've been exposed and are not vaccinated. For other kids, you know, if you have a kid who has an immunocompromising condition, who has cancer, a pregnant teacher, these are folks who cannot get vaccinated. And so it's really not fair to be exposing them to this very high-risk situation by letting our measles vaccination rates drop.
Wow.
Dr. Celine Gounder, always appreciate when you join us.
Thank you, Celine.